Next, we'd like to call Alexa Yutzy. Ms. Yutzy, welcome to committee. You may proceed.
Thank you. Good afternoon. I'm here today to express my full and deepest support of HB 248. The bill in its entirety is an incredibly important piece of legislation to protect the freedom and dignity of all Ohioans. My name is Alexa Yutzy, and I'd like to introduce why HB 248 not only has my full support, but begs of me to spend my time, energy, and resources to be certain that it passes, as it is written exactly and without any compromising amendments. I'm a wife, mother, and professional healthcare worker. I've had the privilege of earning 3 bachelor's degrees in separate fields: biblical studies, applied linguistics, and nursing, which I only state to show that it's safe to assume I'm educated on a variety of topics that pertain to vaccines. However, one does not need to be any of these things or to have studied any of these things to know that it is the right thing to do to protect someone's medical freedom while protecting them also from experiencing discrimination. I'm appalled to see the list of opponents to HB 248. I'm certain that the lobbyists from these medical entities and organizations who oppose this bill will push any and every current and future vaccination on their employees. If this legislation does not pass exactly as it is written, I've personally and professionally experienced this fight for many years. I know many healthcare workers who have left the field or will leave the field if their bodily autonomy is further compromised, especially with the COVID-19 vaccine, but not limited to that vaccine. Let me share with you how well most of these medical organizations who oppose this bill protected their frontline workers, the backbone of the hospitals, during the pandemic, and why they should have no authority over the personal health of anyone. Despite knowing that COVID-19 was airborne from the very beginning, many of us who worked with COVID-19 patients were initially told not to mask around our patients to keep them from being afraid. Then we were told we could wear bandanas to protect ourselves. Our N95s were taken away from us. They were locked up in managers' offices. They sat unused while staff were sickened and exposed to COVID-19. We were constantly told that we were running out of supplies, masks, gloves, gowns, etc., and that we would just have to reuse them. These are the companies that are opposing this bill. I was considered high risk because I was pregnant throughout the entire pandemic. I signed up for 7 shifts when this all started, and I just found out that I was pregnant back in March. No accommodations were made for my safety or the safety of my baby. The CDC continuously changed its guidelines for healthcare facilities just that hospitals could say, see, we're following the guidelines, so you still have to show up to work under these conditions, knowing that this virus was airborne. I was told I could put on my dirty mask and place it in a paper bag when I was done to reuse each shift. Great, so now the germs that were on the outside of my mask are on the inside of my mask, and I'm putting it back on my face. I'm rebreathing contaminants. It was baffling, and it was shocking as an educated nurse. I cannot emphasize how grateful I am for my place of work, as they eventually provided each of their staff members in patient care with sanitizable half masks. Other healthcare workers at the very medical facilities who opposed this bill were not and are not as fortunate. The opposition to this bill by any healthcare organizations is insulting, and it breaks the very code of ethics that many of their healthcare professionals take. It breaks the nursing code of ethics. It breaks the AMA physicians code of ethics. These codes include statements in that the healthcare team member will avoid coercion, paternalism, and interference with patient autonomy, no matter if the caretaker agrees with that decision or not. Their viewpoint in favor of mandatory vaccination and discrimination based on vaccination status is certainly not shared by the majority of their very own frontline workers who truly value medical freedom for themselves and for their patients. When someone is under my care as their nurse, I advocate completely for the freedom to make an informed decision on what medicines and procedures that they would like to have during their time at the hospital. Believe me when I say I am the nurse that you want on your side if you want individualized care, if you want care that is appropriate for you and not the population at large. I beg the same loyalty from my legislators, for myself, my family, and my community. Thank you for your time and the opportunity to share my viewpoint with you. Many of us healthcare workers feel powerless and silenced on this issue. Medical freedom is a battle I decided to take on years ago, and I feel compelled to represent those who feel that they are unable to speak out. I urge you to fight for medical freedom and stand up to the pressure of lobbyists who seek to destroy this bill by either not passing it or by amending it in such a way that it defeats the purpose of it. You must act on this chance to abolish mandatory vaccinations, all of them, and discrimination based on vaccination status. Thank you.
Thank you very much for your testimony, and thank you for being with us today. We'll open the questioning with Ranking Member Russo.
Thank you, Chair. Thank you. Ms. Yutzy, is that Yutzy?
Yutzy, yeah.
Yutzy, thank you for being here today. I just have and first, let me just say, the policy for reusing masks, I talk with many healthcare providers who, even as recently as a few months ago, I think we can all agree that having the supply of the necessary protective equipment for our healthcare providers, our frontline emergency responders, that was something that I hope that we learn as a lesson moving forward, that we need to do a better job of making sure that the supply chain and manufacturing of that equipment is available for all of our healthcare workers and frontline responders, so that we don't repeat that again, because that was abhorrent, and we've heard that from many healthcare providers. But my question for you is, as a nurse, and did I understand, do you work in a hospital setting? Sorry, I didn't catch.
Yes, I do.
Yeah, okay, in a hospital setting. My question for you, and I asked this of a couple of witnesses last week, knowing what we know, whether we're talking about COVID-19 and how it's transmitted, the airborne transmission, which you talked about, influenza, or really any infectious disease, but particularly, we'll talk about influenza and COVID-19 because we have vaccines for those. I mean, what is your recommendation as a healthcare provider and in a hospital setting as to what, hospitals should be doing to protect vulnerable patients who are often much older, they have compromised immune systems? I mean, if, the provider is not getting a vaccine or not required to wear a mask if they're not getting a vaccine, I mean, how is it that they should be protecting those patients?
We have standard precautions for protecting every patient in the hospital. We don't want anyone to get influenza or COVID-19. So this is not specific just to people with weakened immune systems. We don't want anyone who comes to our facility to catch these things. We do infection prevention protocols. I mean, one thing that the hospitals could do is make it easier for nurses to call in sick, which deals with staffing. But I know people who come in with the sniffles, with a cough. If you are not displaying these symptoms, you're generally less contagious if you are going to be getting the flu or whatever, because it's droplets with the flu. But people who have specifically weakened immune systems, we have neutropenic precautions where we do wear masks already with those patients who would be predisposed to not survive these illnesses. Thank you.
Committee, additional questions? Representative Byrd.
Thanks again. And so you sparked a question in my mind when you talked about the CDC. And we'd learned recently that there was a connection between, because of freedom of information requests that were put forward, that there was a connection between CDC guidelines to schools and emails from teacher unions strongly suggesting to the CDC what school guidelines should be and what teacher unions would be willing to see in CDC guidelines in order for kids to return to school. So my question is there any proof that hospitals did the same kinds of activities with the CDC and they told the CDC what they wanted to see from the CDC in their guidelines for their hospital employees?
Through the chair. I am not aware of any evidence of that.
Okay.
I know
thanks.
that as someone who worked in the hospital, I was not asking to only wear a bandana in these rooms. I would have preferred that if they were going to listen to people, that they would listen to people actually going into these rooms, and we would have liked masks. Thank you.
Representative Gross.
Chairman Lips, to Ms. Yutzy, thank you so much for being here. Are you aware in the healthcare community of I personally had a children's hospital person come to me and say that they have been forbidden to speak about their views on these things. They are afraid to speak to me because they are not guarded with their private information should they write to me. So they speak to me, but they will not write me. Are you personally aware of healthcare providers, whether they be nurses, nurses' aides, nurse practitioners and physicians, who agree with the freedom to choose whether they vaccinate or not, but are, if you will, perhaps coerced by their facilities to get a vaccine or are threatened with their jobs?
Chairman. I would say that most people do not want to be vaccinated who work in the hospital. I know a handful who quit when the flu vaccine became mandated, and I know several personally that will quit their jobs when the COVID-19 vaccine becomes mandated, because it will. These facilities don't mess around. They will mandate this. I know people who will quit, and I know many people who are afraid to speak out. And protecting our identity in the healthcare profession when we speak about these things goes beyond what you can even imagine. Just nurses coming up here to speak are afraid. We have physicians and clinics that are afraid to report reactions because the vaccine companies will call these physicians, harass them for additional paperwork, additional tests. If you report a reaction, you get so much pushback. I talked to a doctor that said it would be a full-time job proving to these companies that this doctor was seeing reactions, because as soon as he started reporting them, and he was guessing it's more like 1 in 100 that are reacting to the COVID-19 vaccine, he just can't keep up with the vaccine companies asking all of the questions from him without believing that they're reactions.
On that line of testimony, I would like to expand briefly, and we do have other committee members with questions. Just today, since the recess, this morning when I saw all of you, 2 nurses have contacted me saying they know and are aware of flu shot reactions and COVID-19 vaccine reactions, but were told by their healthcare facility that their jobs would be in jeopardy should they report that. So you have testified that I believe you used an interesting word. We feel powerless and silenced on this issue. Mm-hmm. So I have had that 2 times just since the 11 or the 12:50 p.m. recess today. That's really interesting timing on that. Do you know of anyone personally, since you work in a healthcare facility, do you know of anyone personally who's had a reaction to a flu shot?
I do. I know someone to a flu shot. I'm sorry, the COVID shot.
The flu.
The flu, yes. I know people who have had miscarriages. I know people who have had Guillain-Barré. My uncle lost his eyesight in one eye, and that's documented. Yeah, I know a lot of people who have had vaccine reactions, and it goes beyond the flu and COVID-19 vaccines. I used to work in a children's hospital, and we had a little girl die of the MMR. It's on her death certificate. Like, these exemptions and the medical freedom is so important. You think that these things are rare, but they're so underreported. They're so underreported, and we have to start believing people when they say that they're reacting to these.
On Saturday, May the 30th, if you look at your calendars, is Memorial Day weekend, I believe. Saturday, May 23rd, so Memorial Day weekend. I received a call from a major healthcare network communications director in the state of Ohio, who emphatically told me that in her years in her healthcare system, she had never seen a negative reaction to a flu vaccine. I will just say that our discussion did not end well. Mm-hmm. With that said, Representative Plummer.
Thanks, Chairman. Just real quick, you mentioned not having proper equipment to protect your staff. You had to wear a dirty mask. We worked very hard with the governor and his staff, our hospital administrators, to make sure people had the equipment they needed. So was this early on in the pandemic, or was this throughout the entire pandemic that we had a shortage of safety equipment?
I can only speak to my own experience, and early on, we were told we would be reusing masks at my facility. I'm very grateful for where I work, because they did get us our respirators very quickly. But I do know reports of nurses that are still reusing their masks right now.
Representatives, additional questions? Representative Ginter. Oh,
Thank you. Thank you for your testimony, and thank you for your patience. This is not an easy thing to do, I know, and so we appreciate your willingness to come and be here. I have been listening much. I've been in and out of committee hearing today, but I've been listening much to the testimony. I've written down several questions, several thoughts, and you are the lucky person that I am going to ask a couple of the questions to. But one of the things that I would like to state is that the decision that, at least personally, that I am facing, and I know which side of the line that I am upon at this point, but the decision that faces us is not just the efficacy or the danger or non-danger of vaccines. That, although is interesting and I think is conducive to helping to solidify perhaps members' decision on what side they fall on. But I think for myself personally, it comes back to the root of civil liberties and the liberty that we have as individuals. And where is the line that we as legislators, where is that line between civil liberty and public health? Where is that line? And that is sometimes very difficult to discern. One of the examples of that could be that we do have a law in place that requires people to wear seatbelts. And I'm not hearing that debated too much in the State House about that law because we know it protects lives. So my mind goes a lot of directions when people are testifying. But the question I have for you is a couple of questions, if the chair will allow me, is to establish, not only with me, but those who are watching by television, perhaps more clearly where you stand. Although you personally, perhaps philosophically and scientifically disagree with the efficacy and perhaps even the safety of many of the vaccines, certainly the COVID vaccine. Do you believe that the decision is still personal and should be personal, and even though you would not receive the vaccine, you would not deny someone else their right to choose the vaccine?
I believe everybody should have the choice to do what they think is best for their own health. I have a copy of the Nursing Code of Ethics professionally, and I mean, being a nurse isn't even the most important aspect of who I am. I'm a Christian, I'm a wife, I'm a mom. I believe in the right of the individual to decide these things, but I do have the Nurses Code of Ethics, the first provision of that document, where it talks about we help people define what health is to them. And they get to make those decisions, and we facilitate that without judgment and without discrimination. So I'm on the side of freedom for this issue.
All right, thank you.
Thank you.
And if I may, Chair, follow up. And so in light of that, those decisions, freedom of decision, which is the side that I fall upon as well. However, decisions must be informed decisions, and in the court system, we have the prosecution and the defense. In these hearings, we have proponent, and we will have opponent. So there is access to differing sides and opinions. Do you believe in the public and societal arena of information as it currently stands in our nation? Do you believe that we as citizens have had a right to unfettered and undiluted and filtered information in regards to both the positive and the negative in both the opposition and those who are in favor of the COVID vaccine?
I don't believe we have fair information on it at this time. I think it's been heavily one-sided. If you go by just what's available freely and in the mainstream media, I think it's a very one-sided information and not the full scope of what's going on.
One last follow-up. Thank you, Chairman. So a little bit of a tag on Representative Gross's comment and question. So it leads me to wonder, in my personal interactions with individuals that work in places that have, for example, enforced mask wearing and so on and so forth, in keeping with orders that have been given in the state that they're in, I have discovered that many of them don't personally, they have confided in me. They say, I don't believe in this, but I'm forced to do it. I wonder how many institutions and individuals and employees really believe, let me put this into a question that you can answer. Do you feel that there are institutions and employees and employers that perhaps don't really believe what they are enforcing, but they are feeling the pressure from the top down, whether that be governmentally or whether that be financially?
I would agree with that statement.
Okay, thank you.
Yeah,
Thank you, Chairman.
Representative Liston.
Thank you, Chairman. Thank you for your testimony. I guess basic question, right? Because healthcare systems do often have requirements about flu shots. What is your perspective on why? Why does Metro Health want you to get a flu shot?
This is just from my own research. Again, I'm not representing any official medical anything other than my own experience. When I have a staff meeting, I have a sheet at the end of my paperwork that says employee vaccination rate greater than 90%, just as the gentleman who previously spoke mentioned. That is tied to money. From what I heard as well, it's a 2% reimbursement from CMS if your employee vaccination rate is greater than 90%. So our bonuses are tied to the 90% vaccination rate for their employees.
Just follow up. The follow up is then, but why, right? So there's incentives within the system to say, hey, vaccination rates are elevated, but why is it set up that way? Like, why does anybody want people to be vaccinated? And I guess.
Well, all of this did come down with the Healthy People 2020 goal, like I was saying, the 90% to get reimbursed. But I do think I'm not out to say medical professionals are evil and they're recommending vaccines just to injure people and all of that stuff. I think there are people who believe that that is the best thing to do. But this bill, I believe, is important because it respects our freedom. And if that's something that I'm supposed to do in my care, I don't believe that employers should be able to pass that on to their employees. If they're worried about their employees' health, I believe that the employee can take care of their health.
Okay, thank you.
Thank you.
Representative White.
Thank you, Chair Lips, and thank you for coming in and presenting your testimony. I guess I wanted to follow up on the conversation about why hospitals or healthcare providers would be discouraging the reporting of complications. Can you review what your knowledge base would be on that? What would be the incentive besides the rating system that was talked about or the reporting? Are there other penalties when you're talking about the financial reimbursement of CMS and all of that? I understand the vaccination rate incentive, but I don't quite understand the vaccination complications incentive to not report complications.
Thank you for your question. There isn't an incentive not to report the vaccine reactions. I believe a lot of people are not educated on how to identify a vaccine reaction. It's a very widespread list of symptoms with any given vaccine. To my knowledge, there is not an incentive not to report these things. It's just a messy system, and they slip under the cracks. And these companies, like I was saying, will call the people who report these injuries and make it very, very difficult for that to be an accepted reaction that goes on the record. I will say, I have a neighbor that got a COVID-19 vaccine, went to the hospital within the 2-week period for a seizure. And I was talking to his wife, and I said, does he have a history of seizures? That's too bad that happened. And she goes, oh, no, that's his first one. It is very, very rare to have your first seizure at 74 years old. Very rare. And I asked her, I was like, well, he just had his vaccine. Did they report that this could happen? And she goes, oh, no, the hospital said that this vaccine is only causing strokes, not seizures. And I told her, I was like, you need to get your information and report this, because if that's what they're telling people, she needs to take it upon herself to report that.
Thank you, Chair Lips. And what I'm wondering about then is what would your suggestions be to improve that process so we can get all the data we need from the providers that are doing vaccines?
I think a complete and thorough medical history of when someone does present with any health complications should include last vaccination, because we look at other things. What did you eat today? What were you out doing? We try to uncover all of these things that could possibly be linked to these symptoms. Very, very rarely will you ever be asked, did you just have a vaccine? I mean, it's incredibly rare to be asked that.
Representatives, additional questions? Representative Young.
Yes, through the chair, Ms. Yutzy, right?
Yes.
Okay. Thank you for coming. Your testimony is compelling. Getting back and tagging off the question with from Representative White, who would report if there was legislation passed for reporting? Who would report? Would you report? Would it be a doctor, an attending physician, an administrator? How would you see that happening?
That is a great question. I haven't thought completely thoroughly in how to make that more effective. I mean, I think it's always great if people can report their own symptoms and then talk to a doctor or whoever, but right now we're just leaving it out there for anybody to report, and health professionals are missing it. So if we want to delegate it to a healthcare professional, we need to make it clear that this is their responsibility and the exact healthcare professional that we want, whether it's the nurse, whether it's the doctor, whether the doctor tells the person, go home and write your report. So.
Follow up, please. How do you do other injuries or things that happen to a patient in the hospital if you're working? How does that information flow occur?
We have occurrence reporting. So let's say a patient falls or something unexpected happens in the hospital. We do have occurrence reporting within the hospital, and things do get missed there too. But I would say that is usually the nurse's responsibility to file that report.
Okay. Thank you, Mr. Chairman. Thank you very much.
Yeah, thank you.
Representative West.
Thank you, Mr. Chairman, and thank you so much for your testimony. I am sitting here watching you labor over all these questions, and I'm just visualizing my daughter who's in nursing school right now and working at the Cleveland Clinic. And I'm listening to you, and I heard you say that the 90%, after Dr. Liston asked your question about 90% of the individuals or 90% people getting vaccinated because of money. Is that what I heard you say?
I don't want to make it sound like everybody is aware of that information of why that policy is in place, that they're just money grabbing. I know that policy came into place when Healthy People 2020 and this, I believe it's 2%, I could be misspeaking, I believe it's a 2% reimbursement got tacked on to employee vaccination rates. So that's when all this came down in nursing. So when the mandatory flu vaccinations happened is when that reimbursement.
Thank you. Mr. Chairman, follow up. What keeps going in my mind and keeps playing in my head is a number of individuals who died while working at the hospital. And in my head, it keeps coming back to me and saying, well, the doctors, the hospitals, have to protect their workers as well as protect their clients or their patients. And does that play a role in that 90% and all?
I believe so. I mean, people who believe that the flu vaccination is protecting the workers, they probably think that they're protecting their employees. I mean, but you also run the risk of injury. So to me, I know the code of ethics for physicians and nurses say we cannot be paternalists. We can't tell people what is good for them and what protects them. It is not our role to protect them in a specific way that we believe would work. People can protect their own health in other ways. I think vitamin D is more effective than the influenza vaccine. So if you want to protect someone's health, make them take vitamin D, make them eat right, make them stop smoking, make them stop drinking. I mean, there's a lot of things we can do to protect people's health than inject them with a vaccine.
So, Mr. Chairman, so wouldn't the hospitals also be afraid of liability as a result of not having policies in place to protect its workers and its patients?
I don't believe there's any repercussions for a hospital if an employee chooses not to get vaccinated. Is that your question? I'm sorry.
I'm sorry, I didn't hear.
Was your question, sorry, can you repeat your question?
Yes, so my question is, wouldn't hospitals be concerned of liability and in terms of their employees maybe suing them as a result of them contracting some virus that was really unknown to individuals like COVID-19 or their patients?
To my knowledge, employees can't sue their, I could be wrong, can't sue their place of employment for not mandating a vaccine and then getting ill with that disease because it's on them to take the vaccine or not. But I'm not aware of any repercussions for the hospital if an employee chooses a different path for health.
And then just one last question. Are you familiar with any employee at your hospital or any hospital that have died from COVID-19 as a result of contracting it from a patient?
And any employees? Mm-hmm. I am not aware of any.
Okay, thank you.
Thank you.
Committee, additional questions? Well, welcome back, committee. You were quiet for a few witnesses, but it's nice to have you back with us this afternoon. I want to do a little repositioning. We did this a lot in the last hearing. This is about freedom. We are not in any way, shape, or form testing or talking about or discussing whether vaccines work or don't work. That's not the point. The point is mandates, forced mandates for either employment or for body autonomy. Saying no to a pharmaceutical product mandates. A product mandate doesn't make you anti-anything. It makes you understand and value individual medical autonomy, privacy, and consent. This isn't about whether a pharmaceutical product works or doesn't work, or safe or isn't safe. It's about freedom of choice. So let's get ourselves centered, have our last three witnesses come through quickly, and remember this is about mandates and freedom in our current society. Thank you. You did a great job. Thank you for
very
being with us today. Thank you.
Thank you.